Good afternoon, everybody. My name is Professor Michael Kidd, Deputy Chief Medical Officer here at the Department of Health in Canberra. This is the national update with the figures as of noon today. In the past 24 hours, 416 people have been diagnosed with COVID-19 in Australia. While this is more than 235 fewer cases than we saw reported yesterday, it is too early to know if this is part of a sustained reduction in the number of cases of COVID-19. Over the past week, we've seen 3,352 people diagnosed with COVID-19 in our country. To date, 17,280 people have now been diagnosed as COVID-19 positive in Australia. Over the past 24 hours, 397 of the new cases were in Victoria. 17 new cases have been reported in New South Wales. 3 of these are overseas acquired, and those people are in hotel quarantine, and 14 cases were locally acquired. We've seen 1 case in the Northern Territory, which was locally acquired and related to interstate travel, and we've seen 2 cases reported in Western Australia, which we understand are recovered cases involving people who were infected with COVID-19 in the past. Sadly, we have passed another milestone today with the announcement that we have had 200 deaths reported in Australia, with 4 new deaths reported in the past 24 hours. Every death from COVID-19 is a tragedy, and these are real people, not statistics. The first death in Australia from COVID-19 was exactly 5 months ago, on March the 1st, with the death of Mr. James Kwan, aged 78, from Perth. Mr. Kwan had been a passenger on the Diamond Princess cruise ship. On May the 19th, Mrs. Alice Bacon, aged 93 and a resident at Newmarch House, was the 100th person to die from COVID-19 in Australia. And today we report that 200 people have died in our country. Our thoughts are with those who have lost their lives to COVID-19 and with their family members and friends who grieve their loss. The people who've died in the past 24 hours were aged in their 50s, 80s and 90s. Nationwide, there are now 399 people with COVID-19 in hospital, which is an additional 33 people hospitalised since yesterday, and this includes many people who have been moved from residential aged care facilities in Victoria. Among the people in hospital, there are now 50 people in intensive care units, which is 6 more than yesterday, and there are 28 people reported to be on ventilators, which is 1 more than yesterday. Thank you to all our healthcare teams, especially in Victoria, who are providing excellent care to those people who are in hospital and especially to those who are seriously unwell. Over 4.3 million COVID-19 tests have now been carried out in Australia, and over 63,000 tests were carried out yesterday. New South Wales Health today has reported that the COVID Safe app has assisted in the identification of an additional 544 people who attended the Mounties Club in the Western Sydney suburb of Mount Pritchard around the same time as a person who had the app downloaded on his phone. This includes at least 2 additional people who have now been confirmed as having COVID-19. This identification of these contacts and the identification of people who are infected with COVID-19 could literally have prevented a spread of serious outbreaks of cases, as we are seeing at the moment in Victoria. This is a timely reminder of the importance of the COVID Safe app in assisting in the tracing and the identifying of the contacts of people who have been diagnosed with COVID-19, as well as identifying the people you do know, the people who share your home and your workplace. The COVID Safe app can also identify people you do not know, people who may have been sitting at a nearby table when you were in a cafe or a restaurant, people who may have been standing or sitting beside you on an aircraft, on a train, on a bus or a tram, people who may have been standing in a queue in front or behind you in the supermarket. If you haven't yet done so, please join with the 6.8 million Australians who have downloaded the COVID Safe app. And please make sure, if you have the app on your phone, that it is running on your phone, and please take your mobile phone with you every time you leave your home. The COVID Safe app is part of the armamentarium which is being used to protect us all. It may assist in alerting you if you have been exposed to someone with COVID-19, and in doing so will protect the health of those you love. Now is the time for everyone in Victoria to go harder and ensure that everyone is following the restrictions in place. While community transmission numbers stay high, this is a risk to all parts of the community. Every time we have hundreds of cases in a day, this will be a risk to more lives over the coming week or so. We remain very concerned about the number of COVID-19 cases in aged care facilities in Victoria. Every case of COVID-19 in an elderly person or in a person working in healthcare or aged care is a cause of grave concern. The Victorian Aged Care Response Centre is now coordinating the work with aged care facilities with outbreaks in Victoria. The Australian Defence Force personnel are supporting the Response Centre both on the ground and in making sure that we are connected and coordinated across governments. We have AUSMAT personnel who are also in the field, including wonderful nurses and also logisticians who have flown into Melbourne from other parts of Australia to assist in the outbreaks in Victoria. We have received disturbing reports that some people with COVID-19 who have been told to isolate in their homes have not been at home when health personnel have come to see how they are doing. If you are diagnosed with COVID-19, you must stay at home. You may not leave your home for any reason. Anyone who leaves their home is making a life or death decision on behalf of other people. If you know someone who's been diagnosed with COVID-19, whether it's a family member or a friend, and they are in home isolation, please reach out to them on the phone. Please offer your support. Please drop around supplies on their doorstep. But please also reinforce to them that they must stay at home. This can be the difference between continuing the spread of COVID-19 in Australia and containing the outbreaks that we're seeing at the moment. To those in Victoria in lockdown, a reminder to please look after your own physical health and your mental health. Your healthcare does not stop just because you're in lockdown. Please, if you develop a new symptom that is worrying you, or if you are receiving continuing care for a chronic condition, or if you are feeling anxious or depressed, please reach out to your GP. Please reach out to your regular healthcare providers. You can use telehealth using the telephone or using a video call to make an initial contact with your GP, and then if necessary, a face-to-face consultation. Attending your GP or other healthcare providers or your local pharmacy to pick up your medication is an accepted reason for leaving your home during the lockdown. But please call ahead to make an appointment. Please wear your mask whenever you are outside your home, and please maintain physical distancing when travelling to appointments or when you are in waiting areas. Finally, I want to end by acknowledging the work of Dr. Tony Bartoni, who today has stepped down and ended his term as the National President of the Australian Medical Association. I've had the privilege of knowing Tony for many years, and we've worked closely, especially over the last 6 months. As a general practitioner working in the northwest suburbs of Melbourne, Tony has experienced firsthand the impact that COVID-19 is having on his patients and his community. Tony has ensured that the AMA has not just been an advocate in their work with government, but has been an active partner in working with government to tackle the epidemic. Tony Bartoni has been magnificent and tireless in his work to support the health and well-being of the people of Australia, and we all owe him a huge debt of gratitude. The new President of the Australian Medical Association is Dr. Omar Khorshid, and the new Vice President is Dr. Chris Moy. Minister Greg Hunt and Dr. Brendan Murphy have both contacted Omar to pass on their congratulations on his election. As a past President of the Royal Australian College of General Practitioners, I know how hard the leaders of our professional organisations work and the great work which they do in support of the people of our country. So thank you to all our healthcare professionals across Australia, and a special thanks to the leaders of our associations, colleges and societies. Thank you very much. I'm happy to take any questions.
Firstly, can I just clarify your mention of those WA cases? Are you saying those people were being reinfected with coronavirus? What did you mean by your mention of them?
Thank you. So the question is about the cases reported from Western Australia. These are what we call historic cases. So these are people who have probably had COVID-19 in the past. They're not infectious at the moment.
And just from a health point of view, when we talk about the fact that some people are not complying with the need to self-isolate after they've tested positive, do you think there's a case for some kind of real-time monitoring of those people electronically so that it can be ensured that they don't go out into the community?
Thank you. So the question is whether we should have some form of electronic monitoring of people who've been diagnosed with COVID-19 to ensure that they stay in their homes and do not go out into the community. So this is an issue for the government in Victoria. The vast majority of people who are diagnosed with COVID-19 are doing exactly the right thing. They're staying at home, they're in isolation, they're staying at home until they are told that by the health authorities that they are no longer infectious and no longer a risk to other people. Unfortunately, we have seen, though, a number of people who have breached the isolation orders. Whether we need to move to additional measures, and we have seen additional measures used in other countries to monitor people who've been diagnosed with COVID-19, is something we'll need to consider in the days ahead. We have Jonathan on the phone.
Professor Kidd, thank you very, very much for your time. I really appreciate it on a Saturday. You mentioned at the top there about the COVID Safe app picking up hundreds, or helping to pick up hundreds of extra contacts in those 2 positive cases. What sort of a milestone is this for the app, and what does it say about how it actually functions in Australian society? Is it now doing what it was anticipated it would do?
Thank you. So the question is about the COVID Safe app and the hundreds of additional people who've been tested as a result of the contacts which were picked up through the use of the app, whether this is a milestone in the use of the app, and whether the app is of course doing as it should be doing. The app of course has been used by the contact tracers in states and territories across the country now for many months. The report that came through, and I talked with one of the senior leaders in New South Wales Health earlier today about this particular person who'd had these contacts picked up using the app is very important because of the community outbreaks which we're seeing, the community transmission that we're seeing in New South Wales, and the large number of people who may have been in contact with someone with COVID-19 who have now been reached out, been tested, are now in isolation, and the positive cases which have been picked up. So this is really important. This is the app doing exactly as it was designed to do. The app, of course, will be even more effective the more people who download the app onto their phones. So please, if you have been delaying that decision about downloading the Commonwealth COVID Safe app, please do so over the weekend, and then of course take your phone with you whenever you're out of the home.
Professor, sorry, if I could just ask one other one. In relation to Victoria, what is the medical advice at the moment as we sit now, just before 4 o'clock on Saturday, about further restrictions?
Thank you. So the question was in relation to Victoria and the advice about further restrictions. So as Premier Dan Andrews has said, the AHPPC has been meeting over the last couple of days with, of course, including our colleagues from Victoria, considering what additional restrictions, if any, may be required in Victoria in relation to the response to the outbreaks that we're seeing at the moment. That advice has been provided and of course will be considered by the Victorian Government as they follow the trends in the numbers which are reported over the days ahead. Please.
In terms, just going back to the COVID Safe app, it has had some success, as you've noted. Is it being used more by tracers since the Victorian outbreak?
Thank you. Well, from the Commonwealth level, we don't actually have the oversight as to what's actually happening with the app, because the app is only allowed to be accessed by the contact tracers in each of the state and territory health departments. So we do get occasional reports from the health authorities in the states and territories telling us about what's happening, but we don't have a day-to-day overview of what's happening with the app.
And New South Wales has reported several cases this week that can't be sourced. How much of a concern is that?
Thank you. So the question is about the cases in New South Wales where a source of infection has not been able to be identified, and how much of a concern is that? Clearly, it is a serious concern every time we have a case where we are unable to trace it back to see who infected who in the train of transmission. And the authorities in New South Wales have been doing an extraordinary job over the past few weeks in working very assiduously to create those links between each of the cases. And then, of course, we were able to identify where the people who've been infected have travelled, the venues and facilities which they may have been in, and then we're able to do further contact tracing with the people in those areas. If we suddenly have a case that appears and we don't know what the links are, then it makes it impossible until we are able to identify those links to be able to go back and work out who needs to be contacted, who needs to be isolated, who needs to be tested. Again, this reinforces the value of the COVID Safe app, because if the app is downloaded on the phone of someone who we don't know what their links are, by working through the contacts on their phone with the COVID Safe app, we can start to identify some of those links and work out where the source of infection has been.
What kind of federal intervention additionally is needed, or what more can be done to address the outbreaks in Victorian aged care from a health perspective?
Thank you. So what additional measures can be done to support the work which is being done to tackle the outbreaks in aged care in Victoria? So over the last week, we've seen the establishment of the Aged Care Response Centre, which commenced operations just on Monday of this week, 6 days ago, in Victoria. This is a joint endeavour between the Australian Government and the Victorian Government, working closely with many other organisations and with the aged care providers and facilities in Victoria to tackle each and every outbreak as it occurs. And as we've seen very rapidly, we've seen the deployment of clinicians, we've had the involvement of the Australian Defence Force personnel, we've had a lot of additional people going in to provide support, particularly where we've had to have staff who have been in contact with people with COVID-19 taken out of the workplace, so making sure that we get continuity of care for the residents. We've had the transfer of many residents out of aged care facilities and into hospital facilities, particularly those who have been unwell and unable to be cared for in the residential aged care facility, which is their normal home, of course. We've seen improved contact with the family members, the loved ones of residents in many of these aged care facilities. We've seen a big boost in the provision of personal protective equipment out into residential aged care settings right across Victoria. So there's been a very rigorous coordinated response over the past 5 days, and that will continue to grow over the days ahead as we get each and every one of these outbreaks under control. Final question?
Do you think perhaps is needed here? I mean, looking forward, do you think it's going to be additional medical staff or defence staff? Is it for a supporting role? What do you see as the next steps that will need to be taken?
Thank you. So what are the next steps that need to be taken in tackling the aged care response? So fundamentally, the next step is the step that everyone in Victoria takes, and that is adhering to the restrictions which are currently in place, the restrictions which are protecting everybody and which are there to stop the spread. The tragedy that we see with community transmission of COVID-19, and we've seen this in countries all around the world, is once you start getting community transmission, you start getting cases in residential aged care facilities, you start getting cases among other elderly people in the community, among people with chronic disease, the people who are most at risk of serious consequences of COVID-19. So these measures are measures that we all need to be taking. At the same time, we've seen a real boost in the number of Defence Force personnel, particularly clinicians who have moved into Victoria. We've seen the magnificent nurses and logisticians who've come in from other states and territories to support the outbreaks in Victoria and work alongside their peers. This is a very strong concerted effort between everybody involved, and it's to protect the health and well-being of our most senior residents.
If you would bear with me just one more, sorry.
Yep, sure.
The advice has been handed, we understand, to Victoria. So what does it recommend to reduce the spread?
Thank you. So the advice has been handed to Victoria. Is the question, what does the advice recommend on the spread? I'm sorry, that is advice which we'll have to wait and hear from the Premier of Victoria as he considers the advice which has been provided. Thank you all very much, and thank you to our interpreters. Thank you.